families are paying roughly $20,000 a year in insurance premiums, deductibles, and out-of-pocket costs just for health care. Yet Baltimore's nonprofit hospital CEOs are getting wealthier each year while crying for more funding. Joining us now, CEO and founder of OpenBooks.com, Adam Andrzejewski. Adam, good morning.
Good morning, Tom.
Let's talk about this COVID national emergency. It's over. Hospital administrators say they lost millions and that staff left in drove across the country. How did Baltimore's nonprofits do now that the pandemic dust has settled?
Well, Baltimore's largest nonprofit hospitals, they profited during the pandemic. It sounds unseemly, but here's what we found. Johns Hopkins medical system, their net assets coming into the pandemic in the year 2019, the net assets were $4.1 billion. In 2021, after 2 years of the pandemic, the net assets increased to $5.2 billion. It was a 25% increase just over 2 years in their net assets. That's $1.1 billion flowed to their bottom line. So you take a look at the University of Maryland medical systems, and they had net assets coming into the pandemic in 2019 of $2.7 billion. There was a $600 million increase, about a 22% increase, up to $3.3 billion. So both large nonprofit systems, they profited during the pandemic.
Well, Adam, we heard them for months, years actually, during COVID, begging for COVID aid because they said they were spending so much and a lot of people weren't coming in for regular services and they had to push everything aside for just COVID patients, which meant regular patients for other things were not coming in, so they were losing a lot of money. How are they now making billions over those 2 years?
So, part of it was the COVID aid. So Johns Hopkins medical system, they took $500 million from Congress, $500 million in COVID aid. So think about that, Tom. $500 million, $500 million. For every dollar they took in COVID aid, their net assets during that period increased by $2. Now, the University of Maryland medical systems, they took $700 million from Congress in terms of COVID aid bailouts, and their net assets increased by $600 million. So 85 cents on every dollar they took in COVID aid actually flowed to their bottom line.
Adam, last question for you. We have 30 seconds. How about CEOs, salaries?
Well, we'd like to know more during the pandemic, but coming into the pandemic, Johns Hopkins, the CEO, he made $2.2 million over at the University of Maryland medical systems. In 2020, on the pandemic year, he made $3.4 million. So it certainly looks like these nonprofits are making big profits, and so are the CEOs.
Adam Andrzejewski with OpenBooks.com. Thank you.
Thank you.